We moved my sister in with us and told her, don't worry about it. Don't you worry about rent. Don't you worry about anything. She was able to concentrate on her diet plan and doing what's necessary for her care, concentrating on her care plan. She didn't have to worry about the financial burden.
Heartbreaking truth from an Indiana woman who witnessed her sister struggle with access to health care as she battled kidney failure. The stress of finding and paying for care is all too familiar for many families.
Tonight, WRTV's Amber Grigley explains how one woman's experience helped inspire Indiana's first Black-owned dialysis clinic, working to eliminate the financial barrier to life-saving care.
I say that she was blessed because Kila lived a full life. Even though she passed away at 38 years old, Kila had accomplished all that she set out to accomplish.
Kila Adams thinks back on the life of her twin sister, Kia Adams, who died of kidney failure at the beginning of the year.
She loved her family. She would give you the shirt off her back. When Kia got sick, she was on a limited income, of course, and people would be in need, and she'd go buy groceries for them, and even when she didn't have any income coming in herself, she believed in blessing other people, and in return, she was blessed herself.
Kia was diagnosed with kidney failure nearly 6 years ago.
She was coughing. She was coughing a whole lot. And I was like, Kia, you need to go get that checked out. She was like, no, I'm okay, just coughing a lot. And it got to the point where she just couldn't make sentences in between anything she was saying. And so I was like, I'm gonna take you to the doctor. I'm gonna take you to the hospital. She was like, no. Because when you go to the hospital, you never leave.
Advocates say that hesitancy to seek treatment is often tied to financial insecurity for Americans who fear their income or health insurance won't amount to the care they deserve.
It's really stressful to have limited means and to try to think, am I going to pay my rent? Am I going to buy some groceries for my kids? Am I going to get that bus pass I need to get from A to B? Or am I going to go and get my teeth cleaned?
Thankfully, Kia's sister, Kila, didn't stop there and took her sister to the hospital to see what was really behind that disturbing cough.
And they said, well, she has pneumonia. She can go home. So I was packing up her stuff, getting her ready to go home. They said, no, she has to stay. Her kidney functions are under 10%. We're going to start on dialysis immediately. That's when we found out that Kia had end-stage renal kidney failure.
That day rocked the Adams family world.
So she moved to another dialysis center, which she didn't like very much. It was very detrimental to her well-being. Every other day, she'd be like, we had to wait outside in the cold again, and a lot of issues that you shouldn't have to worry about being on dialysis.
But a guardian angel was there to help Kia through her treatment.
YVETTE was there from the beginning. She helped her get health care. She helped her find a facility and literally took care of my sister.
As always, when you do things for other people and you see things that happen that you don't necessarily agree with, you always think, what can you do to make it better?
Inspired by her desire to provide better care for patients like Kia, YVETTE went to work with her partners, Richard Russell and Kalina Weatherly.
It kind of came together pretty quick.
Nice.
A conversation one day.
2 months later, we were getting our EIN number.
And opened the first Black-owned dialysis clinic in Indiana, Optimal Dialysis on the city's east side.
Most places, unless you're a big company, can't do that. But we were hard work, steadfast, and we were determined to make it work.
Creating a facility to provide quality care regardless of financial status, with a focus on serving those in underserved communities.
They're going to get the one-on-one care. They're going to get the same attention you'll get if you was $100,000 or if you make $10,000, if you was private pay, if you was Medicaid. Here, everybody's on the same playing field.
It's hard to live your best life when you don't have access to even the basics of healthcare.
Michelle Trivedi with ARC Indiana says the U.S. has the greatest medical care in the world, but our healthcare insurance system is complex and difficult to navigate.
You can find yourself having to pay a deductible of $5,000, $6,000, $7,000, even up to $10,000, even if you have insurance. And so then think about what it would be like to face those types of costs without the benefit of having health insurance.
God, I thank you. That was actually Kia's last Facebook post. Maybe a couple of days before she passed away.
Optimal dialysis started out with only 2 patients, one being 38-year-old Kila.
She was telling everybody about Optimal. The one-on-one. When I get there, I can get in a chair. I don't have to wait in my car for an hour and a half for things to get ready.
But it was too late to turn things around for Kila. She passed away shortly after in January.
I know for a fact that if Optimal was around when my sister would still be here. I don't have a doubt in my mind. My sister would be here today. She'd have a kidney. She would be here. She would be here with us. I know for a fact. There's not a doubt in my mind.
There are many stories like Kia's surfacing across the country when it comes to finding affordable and accessible health care, making places like Optimal Dialysis a valuable resource to many across the Circle City to get the care they deserve.
To be able to connect to the patients and to all our staff and to work together and make a difference. I just look forward to being able to help our community and being able to work together and grow together and be successful.
Working for you, I'm Amber Grigley, WRTV.
Optimal Dialysis has a waiting list with people anxious to start treatment. The clinic will have their official grand opening on Sunday, October 17th at its location on the east side off of 56th Street. Open enrollment for coverage for the Affordable Care Act runs from November 1st until December 15th. You can visit www.healthcare.gov to explore many resources through the Affordable Health Care Act.